Hello again. The World Health Organization says it's tracking a number of new subvariants of the highly transmissible Omicron strain of the coronavirus. The organization wants to assess whether they are more infectious or dangerous. Well, let's discuss this further now with researcher Professor Tulio de Oliveira joining us this hour. Prof, good afternoon. How many subvariants are there now? I mean, just a few weeks ago, we heard about one in the UK. Now I understand there's another one that has been seen in South Africa or found in South Africa. Can you enlighten us, please?
Okay. Yeah. Good afternoon. So basic at the moment there is five subvariants of Omicron, which are easy to follow because they got the number 1 to 5. They are called BA1 to BA5, and what's happened is that in the last week, another two were discovered in South Africa. That's called the BA4 and BA5. Yeah, and what we did is prompt to inform our Minister of Health, but also the World Health Organization, which yesterday decided to highlight that were important variants or subvariants to keep an eye on. Very important. Doesn't mean that they emerge in South Africa. They could have been emerged anywhere in the world, but it is just that in South Africa, we have quite a very good advanced genomic surveillance system that we can identify them very quick.
Okay. Does this mean we could face more infections? I mean, I haven't looked at the latest numbers. Do these subvariants BA1 to 5 mean that we're going to get sicker again? That the fifth wave might even be more hectic for us, or we shouldn't worry?
At the moment, we have no reason to worry about that because, for example, we just had another sublineage, the BA2, yeah, that came in South Africa around February, yeah. And despite that sublineage dominating the infections, we didn't see an increase in infection and hospitalization. So the BA2 was the one that were responsible for that tailing end of the Omicron, where every day we see 1,000 to 1,500 infections. Yeah. So at the moment, we have no reason to worry about that sublineages, but it is very important to detect them very early and keep quite alerted in case infections start to increase. But at the moment, we have every single reason in the world to believe that our previous immunity in the population from previous infection and especially from vaccination, it will hold very well against that sublineages and potentially even against another variant.
Yeah, so far there's been no other variant that's been discovered beyond Omicron.
Yes, that's exactly. So far, the World Health Organization, the one that tracked variants, only have identified 5 of them, with the Omicron is the last one. And everything that have been identified since then is what we call sublineages of Omicron, such as BA1 to BA5 that I just described, or some recombinant viruses from Omicron. But when they recombine, they keep the same properties as Omicron. Yeah, so at the moment, no new variant has been identified, but that also doesn't guarantee that the next wave will have to be caused by a new variant. So that's something that we have just to look very carefully and really hoping and expecting that in South Africa the worst is behind us.
So vigilance and monitoring will be like two of the operating words. While I have you, Prof, before I let you go, just want to say congratulations. We hear that you and your team have received an award of recognition of your contribution as scientists in this journey. I mean, well done to you. What award did you get?
Yeah, thank you. Yeah. So recently our team, they got 2 awards. One's the Batopele Award from the government, which we are really happy to be among the civil servants that recognize to help the country to become a better country. And the other one is the South Africa Medical Research Council Gold Medal Award. Yeah, but for us, awards are always welcome. But for us, the most important task, is that very early, very advanced genomic surveillance can really help to identify what's coming next, and in that process save lives. That's for us the most important thing.
Okay, well done. Thank you very much, and keep on doing the great work. And thanks for the update on these sub-lineages, subvariants of Omicron. And it's good to know that you are watching them like hawks, literally. And hopefully they don't really develop into nothing more serious. Nothing at this stage to worry about. That's Professor Tulio de Oliveira.